Hi, everyone, and welcome to Ask Miss Jai Live. I'm very excited for us to have our conversation today. So, today I'm going to be talking about how you can create affirming health campaigns for trans and non binary communities if you are in charge of or working in a program that is creating health campaigns for our community. So, how to engage us and also how to make those campaigns effective for our communities. So, stick around and learn a little something about that. Thank you for joining for Ask Miss Jai Live today. I am your host, Miss Jai. I use she, her, and he, him pronouns, and I'm the CEO and founder of Ask Miss Jai. Today, I'm going to be talking about how you can create affirming health campaigns and health messages for trans and non-binary communities. My background is in public health and working with LGBTQ communities, specifically trans and non-binary communities, and also in healthcare and helping to support trans and non-binary patients navigating a healthcare system. So health campaigns come out for a variety of reasons among healthcare and public health providers. They come out for prevention, for treatment, for linkage to care. And so what I'm going to be talking to you about today is how you can craft those health messages in a way that is going to be effective for trans and non-binary communities. I would love to hear your questions and comments as we're going through this. So please feel free to put your comments in the chat or in the comment section below. If you're checking this out on YouTube or on LinkedIn, then I should be able to see those. If you're on Instagram, I should also be able to see your comments. So please feel free to share those as we're going through this. And if you're catching this on the replay, go ahead and let me know what you thought of today's conversation and any other recommendations or thoughts that you have about creating health campaigns for gender expansive communities. If you're catching this live, go ahead and put a hashtag live in the comments. If you're catching this on the replay, go ahead and put a hashtag replay so I can see who is seeing it when. um, so like I said, my name is Miss Jai. I use she, her, and he, him pronouns. I am the founder and CEO of Ask Miss Jai and I'm your host for Ask Miss Jai Live. My background is in public health and in healthcare, specifically working with gender expansive communities. And part of that work included running a number of focus groups earlier in the year for trans and non-binary communities around the health messaging that was going to be coming out of a state public health department focused on MPOX and getting MPOX information out into our community, and also encouraging trans and non-binary community members to get vaccinated for MPOX. So we ran a number of focus groups with trans and non-binary folks out of the Southeast, Southwest, and then we also did a number of follow-up discussions with what the goals of the health messaging was going to be, or this health campaign was going to be for the health department itself. And so based off of those conversations, I come to you with a number of recommendations, tips, if you are creating your own health messages for trans and non-binary communities. So the first tip that I have for you is to understand how trans and non-binary people feel about health. I'm going to be talking about some community some of the recommendations and some of the experiences that came out of these community discussions. But I do think it's important to caveat that our communities are going to experience or feel differently about health based on where we live, our access to services, how affirming or supportive those services are, and what it means for us to be able to get our service needs met. So some of the some of these might be generalizations, but might not be fully generalizable to your specific nuanced trans and non-binary community. So some of the things we learned from these conversations around how trans and non-binary folks felt about their health was that their health is holistic, that it's not just focused in physical health, but they consider health to be aspects of physical, mental, spiritual, emotional, and communal. That it's not, and that any health messaging needs to really address multiple aspects of health, not just focus strictly on physical health. As a leaping off point of that, there was also a lot of feedback that being healthy isn't the absence of illness or disability. And so when we think about, for example, the World Health Organization's definition of health, it is the absence of disability, infirmity, and illness. And so the ways that the trans and non-binary community that I was speaking to thought about health was that it's not an absence of these things, but instead it's a focus on quality of life, on reducing pain, and on doing things that improve a sense of joy in our bodies and in our communities. And so if our focus on health messaging is just to prevent disability or illness, then it's going to not be as effective for the folks that we are trying to, for trans and non-binary communities specifically. And also because there are lots of folks who are living with a disability or with a chronic illness that can still experience health and still have a drive to be healthy. And we don't want to exclude those folks from the conversation. This also means that we need to not take feedback personally when we are putting information out into our communities, and we need to make sure that we are incorporating it when it does come up. And I apologize that there is like background noise right now as well. That will be ending here in just a moment. The third thing around how trans people feel about health based on these conversation is that there's a high motivation for trans folks to be healthy. So it's not, sometimes I hear that there's like a lack of motivation or that trans people are just less engaged in healthcare or in public health or in health initiatives. And it's not that there's a lack of motivation to be healthy, it's that there are systemic and social barriers to accessing those services or to feeling like those services are applicable to our health. And so I think it's important for us to understand that because we have this high motivation to be healthy, it's not because we are not willing to engage in these things, but oftentimes it's additional barriers that exist for us that make it hard for us to engage in being healthy. The second thing that I encourage you to think about is to understand how trans and non-binary people feel about current health messages that exist in our communities. So a lot of these messages feel like they've been created for us instead of with us, that community hasn't been even asked how we feel about these messages. And so we feel like we're sometimes a little bit tokenized or stereotyped as a result of that, or that they don't really resonate with us. That being said, when folks are seeking out health information, because like I said before, there's a high motivation to be healthy. Lots of folks responded that they have to dig really deep to find health information that is applicable to our health and well-being, and that when we do find it, it's inconsistent or it's not inclusive of trans and non-binary people. So it might talk about the health condition we're looking for information about, but it doesn't mention anything about trans and non-binary people. So it feels like it actually isn't taking our health needs into consideration, or the only focus is on risk and reducing risk or on physical health. And generally with physical health, it ends up talking about sexual health. And because we are whole functioning human beings, we have a variety of health concerns that go beyond just our physical health and go beyond sexual health. And so when the focus is just on physical or sexual health and the focus is just on reducing risk, it feels like it's not actually addressing what our needs or concerns are around our health and well-being. And then the third note about understanding how trans and non-binary people feel about current health messages is that oftentimes the health messages that are already, or health campaigns that are already out in the world, treat trans people as a monolith. So copy and paste, all trans people are going to have the exact same concerns. And we know that our community is incredibly diverse and our health needs are equally as incredibly diverse. And so as a result of that, we can't treat health messaging for trans and non-binary communities as a one size fits all. So if you are joining this conversation midway through, we've just talked about how it's important for us to understand how trans and non-binary people feel about health, as well as understand how trans and non-binary people feel about current health messages when you are creating affirming health campaigns for trans and non-binary communities. Now I'm going to shift gears and I'm going to talk about what you can do to craft the message and what you want to avoid. So when you are crafting the message, the health message, the health campaign, the first point that I want to bring up is it's important to include community in the creation of your health messaging. And so, what I mean by including community is pulling together a community advisory board of trans and non-binary folks, of gender expansive folks, of folks who are in positions of leadership in the trans and non-binary community, as well as folks who are well respected in the trans and non-binary community, but maybe don't work for an organization. So bring together community members who are community champions around the health and well-being of trans and non-binary communities to help craft this health messaging and help direct this health messaging. So maybe what that looks like is we do a community needs assessment and we identify that trans and non-binary people are more likely to be smoking. And so we want to start a smoking cessation health campaign for the gender expansive community. Then we might bring the data and this information that we've learned to a community advisory board and say, this is what's happening. Do we know why smoking is more prevalent in this community? Do we know um, what if folks have any concerns about how smoking will impact their health, and how can we craft a health message to encourage folks to reduce the amount that they're smoking, so that they are able to stay healthy for longer. So include the community in the creation of your health messaging. I also want to encourage that if you are working in an organization where you're able to pull together community members, please pay folks for their time and energy. Bringing us together and asking us for our subject matter expertise is a valuable resource. And so we want to make sure that we are not just incentivizing, but that we are showing trans and non-binary community leaders that their expertise is valuable. The second thing is that it's important for us to have trans and non-binary representation in our health messages, but that can look in a couple of different ways. So we can have health messages and campaigns that are tailored specifically to trans and non-binary communities, and we can have health messages and campaigns that have trans and non-binary people included in the campaign, but are not solely focused on trans and non-binary communities. There's a benefit and challenge to each, right? So we want to make sure that we are trying to provide both for our trans and non-binary communities, but sometimes trans folks don't feel comfortable or safe picking up a brochure that has a trans person's face on it or has trans listed on it, and other times the opposite is true. So we want to make sure that we are creating both kinds of materials for our communities to meet folks where they are at and making sure the health message is getting into our community. We also want to try and avoid, well, I'll talk about avoiding here in a minute, but that's what we want to do. You also want to focus on bodily autonomy and joy in health. And so what I mean by that is that you want to focus on health messages that are not just avoiding risk or trying to reduce risk for something, but focus on how being healthy, how engaging in these ways, how shifting behaviors is actually a way for us to explore and express our bodily autonomy and to find joy in our bodies and joy in our health and in the ways that we are engaging in our health. Our health messages also need to include physical, mental, emotional, spiritual, and communal aspects of health. So, what is with the smoking cessation example before, there's a physical component to it, but there also might be a mental and emotional component to it. There might be spiritual components to it. There might be communal aspects to it as well. So, if we are reducing our smoking, then we are less likely to expose other trans and non-binary folks in our communities to secondhand smoke, right? So making sure that we are bringing in multiple aspects of health, not just focusing on the physical aspect. We also want to make sure that our health messages are translated into the languages that are commonly spoken in our communities and in our local communities and in our service area, and that they're comprehensible, meaning that they're not written at a high school or college level, but they're written at a sixth grade health literacy level or below, that they are that when they are translated into multiple languages, they're still written at that literacy level, and that when we're putting out information, that it is also accessible in the ways that it is um, in the ways that it will be perceived as well, not just in the ways that it is written. So I made a mistake, as we often do, but I made a mistake today, and it was actually brought to my attention this morning that the newsletter that I send out every week, that is full of resources and health information for trans and non-binary communities, I have set it up so it's dark teal with light blue hyperlinks on top of it, and that's not visually accessible for folks who experience certain forms of color blindness. And so someone reached out to me and said, "Hey, this is not accessible. I can't read this." So I see that there's some sort of link, but I don't know what it actually says. And so I think that when we think about things that are translated and comprehensible, we're not trying to get to a everything is perfect, but I think it's us being able to acknowledge and work with our communities to continue to improve, so that we are not avoiding it or putting out information that is still accessible or not able to be understood by some of our communities. And then the final note I want to make about how to craft the message is that you want to have a clear call to action as well. So a clear call to action is call to action is, what is the actionable step now that we know something about this? So some health campaigns will just be to get information out into our community. Um, but we want to make sure that the call to action is really bringing folks to the next step, meaning that they're going from now I understand about heart health to what can I do about heart health. So make sure there is a clear call to action. And now I'm going to talk a little bit about what we want to avoid in our health messages. So there's four points that I want to make about what to avoid in our health messages. The first is any fear-based messaging. So if we have messages that say, like, one that I saw a lot of was that you're more likely to be attacked by a shark or struck by lightning than X, Y, or Z thing, or the opposite, rather, right? You're more likely to experience a cardiac event than to be struck by lightning. And the imagery is always very fear-based. So it will be folks swimming with sharks or folks being struck by lightning. Um, and fear-based messaging can be helpful in capturing attention in the acute moment, but it isn't super helpful in actually changing behavior or changing or encouraging folks to take care of themselves or to shift the ways that they think about their health. So even though we are getting more eyes potentially on a message, it's not actually as effective. And in the trans and non-binary community, in the focus groups that we ran, folks really expressed a disinterest and a dislike, and that fear-based messaging actually turned them away from the service. Similarly, we want to avoid only focusing on health risk. So if we think about it as like, you need to change because otherwise you'll have increased mortality, or you might die, or you might get your illness might get worse. That is also eliciting this fear, and it's not as effective for the communities that we're working in and for the focus groups that we ran for trans and non-binary folks. They were saying that really, when we only focus on health risk, it doesn't tell us why. It doesn't give us the additional information as to why we might want to make a change. Where again, how are we getting to that joy, to that bodily autonomy? How does improving our health actually improve our quality of life as well? And so, with that, we want to also avoid any messages that are paternalistic, so talking down to our community. There was one that came out through an organization a while ago around condom usage, and the messaging was very much just like, just put on a condom, just wear a condom, stop being a child, just wear a condom. Like, thing that was kind of the feel of the messaging, and so we want to avoid paternalistic messages that talk down to us, because oftentimes we are grown adults moving about our daily lives. For those of us who are adults, moving about our daily lives, and we have a variety of competing priorities and interests. And so when we are talked down to in that way, it's more likely to turn us off, or have us avoid trying to engage in those services in the future, especially when we are treated in paternalistic ways in a variety of aspects in our lives as trans and non-binary people trying to just navigate our daily lives. We also want to avoid messages that are pathologizing or stigmatizing. So I mentioned before, making sure we have health campaigns that are both tailored specifically to the trans and non-binary community, and some campaigns that have inclusive materials. We want to make sure that when we are putting out health campaigns, we aren't solely focusing on trans and non-binary communities around a health topic that impacts more than just trans and non-binary communities. Because then what we end up doing is unintentionally stereotyping or stigmatizing or pathologizing trans and non-binary people, and saying it's only trans and non-binary people who are impacted by HIV, or who experience heart health issues, or have mental health challenges, or experience severe psychological distress, right? So we want to avoid especially with these larger campaigns, we want to avoid just focusing on trans and non-binary folks because we don't want to draw a false correlation that being trans or non-binary results in this health outcome, or that only trans and non-binary people experience this health outcome. And then the final feedback from this group was that we are kind of sick of seeing the same stock image depictions of our lives. So we're all very familiar or have seen many health campaigns that are the same trans and non-binary people from Canva and from the Canva stock photos. And having been someone who sold my image to a stock photo company or to a photographer who sold it to a stock photo company and ended up putting my face on a variety of materials across the globe as a trans or non-binary person, it can start to feel really disingenuous around how this is actually connecting with our community and how this and if any work has actually been done with the local community or the community in the service area. And so what I would recommend in order to avoid that is to either focus on working with with these same community champions and having those folks become the face of the health and well-being of our community and again champions for our health and well-being, and making sure that we are balancing with not just and or balancing with those stock images to also include folks who are local or on staff or who are doing this work, so that we're able to connect and link this to it's not just stock photos. It's not just to try and get trans and non-binary folks in, but that there's actually an investment in the trans and non-binary community. So those are my tips for creating affirming health campaigns for trans and non-binary communities, and affirming health messages for trans and non-binary communities based off of our work, based off of the focus groups that we ran. If you'd like more resources on how to serve trans and non-binary communities, please sign up for our weekly newsletter at askmissjai.com/mailing-list. I will put that in the description below as well, so you can just click on it. And then as of today, we have also launched our course for healthcare providers titled Foundations of Transgender and Non-Binary Patient Care, which is available for individual purchase or if you work for an organization. It's also available for group purchase through your organization, and is there's different rates for nonprofit and for profit. So please feel free to reach out or let me know in the comments if you'd like me to send that to you. And if you like today's Ask Miss Jai Live, please go to our YouTube channel, or if you're already on our YouTube channel, please like and subscribe to the YouTube channel. And also check out our previous episodes. We are in season 4 of Ask Miss Jai Live, so we have a lot of episodes available. We also have the first season of the Social Determinants of Health series with the CDC, where I'm one of the co-hosts for that series as well, is now also live on YouTube. So please check that out through our YouTube page under our playlists. I want to thank you for taking the time to join the conversation today. And as always, thank you for investing in the health and well-being of transgender and non-binary communities.